Hello everybody, now we are going to discuss cardiac cycle. So all of you know that cardiac cycle, it is nothing but cyclical events which are occurring at the level of ventricles. So I am writing here that cardiac cycle, it is nothing but events at the level of ventricle. Events at the level of ventricles. So when we are discussing cardiac cycle, we are least interested at the level of atrium. Obviously the atrium will go for contraction and relaxation, but we are mainly looking at the level of ventricle. So it is the ventricular events, right? Now we all know that both the atrium forms a separate syncytial tissue and both the ventricle also forms a separate syncytial tissue. So whatever is happening in the right ventricle, the same thing is going to happen on the left ventricle, right? Means both the ventricle is going to cause contraction simultaneously. But there is a little difference which you have to remember for your MCQ purpose. That is the contraction of left ventricle start earlier than right ventricle, very little earlier, although I am saying that both of them are syncytial tissue, but because the depolarization is occurring first in the left ventricle, the contraction of the left ventricle will also start a little bit earlier than that of the right ventricle. But if you look at the ejection of blood from ventricle, then right ventricle will start ejection a little earlier than that of the left ventricle, because you know the right ventricle is ejecting blood at the level of pulmonary artery where pressure is little lower than that of the arch of aorta. Obviously it is lower, and that's why the right ventricle starts its ejection earlier than that of the left ventricle, although contraction of left ventricle is starting earlier than right ventricle. So there is a very little time gap which we have to remember for our MCQ purpose, right? Now the next question is that what is the duration of the cardiac cycle? So all of us know that the total duration of the cardiac cycle is 0.8 second. So this duration is nothing but it is the 60 second, okay, that is 1 minute upon the heart rate in 1 minute. So if you divide this two, okay, you are going to get on an average 0.8 second is the total duration of cardiac cycle. We also know that this total duration of 0.8 second is divided into systolic duration, systole, and diastolic duration, where systole is 0.3 second, all of you know, and diastole is 0.5 second. But this duration of systole and diastole which I have written here, that is for the ventricular. So this is for the ventricular systole and diastole. But if we look at the atrium systole and atrium diastole, it is little different. Atrium systole is for very shorter duration, that is 0.1 second, and the diastole of the atrium is long, that is 0.7 second. So this duration is for the atrium, right? So all of you know this. You have to remember for your MCQ purpose atrium and ventricular systole and diastole. Now there is a question that if a person is doing exercise, what will happen to the cardiac cycle duration? Very simple question. So question is, if a person is doing exercise, so obviously the heart rate of the person will be increased immediately, and I told you this increase in heart rate can occur even before the starting of exercise, right? So whenever the heart rate is increasing, I can easily understand that the heart rate is in the denominator when we are calculating the duration of the cardiac cycle. So what will happen? Increased heart rate means there will be obviously total duration of the cardiac cycle will be decreased. Duration of cardiac cycle will be decreased. But more important question is that when the total duration is decreasing, which duration will be decreased, systole or diastole or both? This was the MCQ which has been asked multiple times. So remember, when the total duration of the cardiac cycle is decreased, your question is systole will decrease or diastole will decrease or both will decrease. Your answer will be both the duration will be decreased, but the diastolic decrement will be much more than that of the systolic decrease. Getting my point? So whenever your total duration of the cardiac cycle is getting shorter, right, diastole will be decreased much more than that of the systolic decrease, right? Because you know that the diastole is a passive process, so the decrement of diastole will be easier than that of the active process, which is the systole, right? So this way you have to remember that whenever heart rate is increasing, diastole decreases much more than systolic decrease. So this is the intro part of the cardiac cycle. Now we have to understand the different phases of cardiac cycle. So cardiac cycle means there will be some phases at the level during the time of diastole, and there will be some phases during systole. And phases of what? Atrium or ventricle? We are looking at the ventricle. I am telling you repeatedly. So during diastole, what are the phases that we have to discuss at the level of ventricle? Look at the name of the phases: protodiastole, isovolumic relaxation, first rapid filling phase, diastasis, and last rapid filling phase. So isovolumic relaxation, I will write down like this, IVR in short form: first rapid filling phase, and last rapid filling phase. I will write down like this during discussion. Similarly, if you look at the systolic phases, then this is isovolumic contraction phases, right? Then rapid ejection and slow ejection, right? So isovolumic contraction, rapid ejection, and slow ejection or reduced ejection. So these are the different phases in cardiac cycle. Now we have to understand what is happening during every phase of this cardiac cycle, because first of all we have to understand the different phases, and then only we will be able to understand the different applied aspect which are related to the cardiac cycle, right? So to understand the cardiac cycle, okay, first I am drawing one circle. Okay, so what I am going to do at this circle, we are going to plot every phases of cardiac cycle within this circle, right? Look at what I am doing. Okay, so I am dividing this circle into two halves. Okay, total duration of this circle is 0.8 seconds. So this is nothing but a cardiac cycle. Every phases of cardiac cycle will be plotted here, right? So the total duration of this cycle is 0.8 second. Now within this 0.8 second, I can easily understand that this small part, this is the portion of systole, and this bigger part, this is the portion of diastole, because we know the diastolic duration is 0.5 second and systolic is 0.3 second, right? So now we are going to start our discussion from the onset of diastole. You can start from anywhere, but if you start from diastole, it will be easier to understand. So we are going to start our discussion from this point. This is the onset of diastole. Okay, so this is the starting point of diastole of the heart. Now during this discussion, right, we are going to think of the right ventricle only for our easiness. Although we know that whatever is happening at the level of right ventricle, the same thing will happen at the level of left ventricle. But we will be looking at the right ventricle, but we know similar event will happen in the left, right? So first I am trying to think that what is happening at the end, at the beginning of this diastole, or I can say beginning of the diastole means this is nothing but end of systole, right? So first of all, I am trying to think that what is happening at the level of right ventricle at the end of systole. So this is right atrium and this is right ventricle. Look at, this is the septum. Okay, so what I am drawing here, as if the right ventricle is fully contracted, tricuspid valve is closed, right, and the semilunar valve is open at the level of pulmonary artery, right. Due to full contraction of this right ventricle, most of the blood has been ejected at the level of this pulmonary artery. So this is my pulmonary artery, and very little amount of blood is still remaining inside the right ventricle. I hope you are understanding. So this is sketchy diagram, this is schematic diagram. Just try to understand that this is right atrium and right ventricular chamber. We are trying to think that what is happening at the end of this systole or beginning of diastole. So the right atrium is fully contracted, most of the blood has been ejected at the level of pulmonary artery, very little amount of blood at the level of ventricular chamber. Now from here, whenever the right ventricle will start its relaxation, just try to think, the right ventricle is fully contracted, now it is trying to relax. So whenever it is trying to relax, there will be expansion of the chamber volume. So whenever there is expansion of the chamber volume, if I ask you that the right ventricle is trying to dilate like this, what will happen to the pressure within this ventricular chamber? You will easily answer that the pressure will drop down immediately. So whatever I am saying, look at that right ventricle is fully contracted, now it is trying to relax. Whenever it is trying to relax, the ventricular pressure will drop down. And this dropping of pressure means what will happen? The blood at the level of pulmonary artery, they will try to fall back or come back towards the right ventricle because the semilunar valve is still open, but this coming back of blood at the level of ventricular chamber is not possible because we know that it will be immediately guarded by closure of this semilunar valve. So look at what I am saying. Okay, this is very, very important. If you just understand the beginning part, every part will be very, very easy. So what I am saying, that after the full contraction, whenever the right ventricle is just trying to relax, immediately the ventricular chamber pressure is dropping down. This decrease in chamber pressure means the blood at the level of pulmonary artery, they are trying to fall back towards the ventricular cavity, and that will lead to immediate closure of the semilunar valves. Everything, whatever I am discussing here, this closure of the semilunar valve, this part is happening within fractions of second. That means whenever the ventricle will start relaxation, immediate or the first event that is going to happen is the closure of the semilunar valve. So I am writing here that the onset of diastole or the start of diastole means it will start with the event that is nothing but closure of semilunar valves, right? So this is closure of the semilunar valve. Now you look at, whenever your semilunar valve is closed, now the ventricle will go for more and more relaxation like this, okay? More and more relaxation like this. So this relaxation is continuing with a closed semilunar valve, and the tricuspid valve was already closed from the systolic part, right? So the tricuspid valve is closed, semilunar valve is closed, means all the valves in the hearts are closed, but still the ventricle is going for more and more relaxation. So do you think the volume of blood which was already present in the ventricular chamber, that was very little, is that volume is going to change during this phase? Answer is no. The volume will remain same because all the valves in the ventricle are closed. So the volume of the blood is remaining same volume with the ventricle in a relaxation phase. This is known as the isovolumic relaxation phase, right? So just after closure of the semilunar valve, now I can understand that the next phase of cardiac cycle that is going to start. So here the next phase of cardiac cycle that is going to start is nothing but isovolumic relaxation phase. So this is the phase which is known as the isovolumic relaxation. I am writing here IVR, isovolumic relaxation phase. The duration of the phase is 0.06 second. So the isovolumic relaxation phase will persist for 0.06 second. Just hold on, I will give a color. This is very, very important phase. MCQ are there from these phases, so you have to understand. So during isovolumic relaxation phase, I can understand that the ventricle is relaxing more and more, but blood volume is remaining same. But what is the net result? Net result is that the chamber pressure will fall more and more. So more the relaxation during isovolumic relaxation phase, more will be dropping of ventricular pressure. And remember, at the end of isovolumic relaxation phase, so here I will write down again, at the end of isovolumic relaxation, the ventricular pressure will be lowest. So lowest ventricular pressure, lowest ventricular pressure, very, very important. It can be asked in MCQ. So lowest pressure in the ventricle that is reaching in which phase of cardiac cycle? At the end of isovolemic relaxation phase, that is near equal to 0 millimeter of mercury. So ventricular pressure will drop down to near equal to 0 millimeter of mercury. Now you look at, so whenever the ventricular pressure is lowest, okay, that means I can imagine here that the blood volume in the ventricle is very less and pressure is very less here, very less here. But when the ventricle was relaxing isovolemically, what was the condition of the right atrium? Right atrium was getting blood from superior vena cava as well as the inferior vena cava. So when the ventricular pressure is dropping more and more during isovolemic relaxation phase, atrium is getting huge amount of blood and the atrium is full with blood. So if the atrium is full with blood, so what will happen to the atrium pressure? I can easily understand that because the atrium is full with blood, atrium pressure will be high and that will be near equal to 7 to 8 millimeter of mercury. So for our understanding, I am writing here, suppose in this condition, the right atrium pressure is 8 millimeter of mercury, right? Normally it is 0 to 5, but suppose we are saying that 8 millimeter of mercury. So ventricular pressure is near equal to 0 millimeter of mercury. Right atrium pressure is 8 millimeter of mercury. There is a huge difference of pressure between these two chambers, and this difference of pressure will leads to opening of this tricuspid valve immediately. So getting my point, whenever at the end of isovolemic relaxation ventricular pressure is near equal to 0, atrium pressure is 8 millimeter of mercury, this will leads to opening of tricuspid valve. So I will write down this event because this is also an important event. So at the same point when the ventricular pressure is lowest, at the same point there will be opening of tricuspid valve, or I am writing atrioventricular valves. There will be opening of tricuspid valve or atrioventricular valve. Now whenever there is opening of these tricuspid valves or atrioventricular valve, what is going to happen? This is very easy to understand. What will happen? The blood will start running towards the ventricular cavity. Why it is running? Because huge amount of pressure difference. So I can now understand that the blood will run towards the ventricular cavity with a huge velocity. Rapidly the blood will enter inside the ventricular cavity. So what will happen? Gradually this ventricular blood volume will be expanded, right? And ventricular pressure, that will also increases. Suppose this pressure is 2 millimeter of mercury. Okay, so whenever the blood is running towards the ventricular cavity, I can understand that there is gradual filling of ventricular cavity, and this filling is occurring in a rapid fashion. That's why this phase after the opening of the AV valve, this phase is known as the first rapid filling phase. So this phase will be known as the first rapid filling phase. Why first? Because there is another rapid filling phase which will appear later on. That's why we have given first rapid filling phase. So during first rapid filling phase, blood is running towards the ventricular cavity because of huge pressure difference between atrium and ventricular chamber, right? The duration of this first rapid filling phase is 0.1 second. So what is happening during the first rapid filling phase? Why the filling is rapid? Because the pressure difference between atrium and ventricular chamber is very high, right? Let me color this. Okay, so life should be colorful, right? So I'm coloring here. Very good. So first rapid filling phase is done. Now after the first rapid filling phase is done, I can understand that the ventricular pressure is gradually rising because more and more blood is coming, and the blood is coming from atrium. So what will happen to this atrium pressure? The atrium pressure is going to fall. So suppose the atrium pressure is now 6 millimeter of mercury and ventricular pressure is 2 millimeter of mercury. Now if I look at the difference of pressure between this atrium and ventricular chamber, earlier the difference was 8 minus 0. Okay, now the difference is 6 minus 2, so that is 4. So the pressure difference has decreased between atrium and ventricular chamber. So valve is still open, pressure difference is decreased from the previous phase. So blood will continue to enter, but this continue to enter will be in a slow manner. because of decrease in pressure difference between these two chambers. So first there will be a rapid filling phase, then there will be a slow filling of the ventricle. Why the slow filling is occurring? The slow filling is occurring because of the reduced pressure difference between atrium and ventricular chamber. So I can write down that after this first rapid filling phase, the next phase that is going to happen is a long duration phase. This phase is known as the diastasis phase of cardiac cycle, which is also known as slow filling phase of cardiac cycle. This is also known as slow filling phase of cardiac cycle. This has a duration of very high duration, 0.2 second, right? So this is known as the phase of diastasis, where the pressure difference between atrium and ventricular chamber is lesser and the blood is slowly moving towards the ventricular cavity, right? I hope you get it. Now this diastasis phase is very important. Why? Because during this phase, the tricuspid valve is open, ventricle is also in a relaxed condition, atrium is also in a relaxed condition, and blood is slowly moving towards the ventricular cavity. This, because of this slow moving, diastasis is that phase where ventricular wall motion is minimum. This is an MCQ. Ventricular wall motion or movement is minimum, right? Please note down. So this is the phase where the ventricular wall is not moving at all. It is almost standstill, wall motion minimum. That is the phase of diastasis. Now again I have to look at this ventricular cavity. Okay, so at the end of the diastasis, I can understand a diagram like this, that atrium and ventricle both are in a relaxed condition. The tricuspid valve is open and ventricle is filled with blood. So atrium pressure has reduced. Suppose now this is 4 millimeter of mercury. So earlier it was 6. Now suppose this is 4 millimeter of mercury, and ventricular pressure has also increased to 4 millimeter of mercury. So during this first rapid filling phase and during this diastasis, ventricle has got enough of blood, and because of that the ventricular pressure has risen to 4 millimeter of ventricular pressure is now 4 millimeter of mercury. Now the atrium pressure as well as the ventricular pressure is almost equal. So now the blood cannot move from this atrium to the ventricular chamber automatically, because both the pressure is same to same, right? So what the atrium has to now contract. So whenever the atrium will contract, it will give a push. Okay, this push will causes rapid entry of remaining blood from atrium to the ventricular chamber. So note down. So during the first rapid filling phase as well as during the diastasis phase, during these two phases, atrium was not contracting. Both atrium was relaxing, ventricle was also relaxing. Why the blood was moving from atrium to ventricle? Because of the pressure difference. Now the pressure of atrium and ventricle both are almost equal, right? So the blood which is still there in the atrium chamber, that is not going to move automatically to the ventricle. Someone has to kick it, and the atrium is giving that kick by causing contraction. So now the atrium will go for a contraction, that is atrium systole. We know the duration of atrium systole, that is 0.1 second. So whenever the atrium will contract, this will push the blood rapidly into ventricular chamber once again. So again there will be a rapid filling of ventricle due to atrium contraction. This rapid filling phase is known as last rapid filling phase of ventricle. If I ask you what will be the duration of the last rapid filling phase, this will be same to same with that of the atrium systole, that is 0.1 second. So please note down, this is very important phase, because during this last rapid filling phase, this is the only phase where atrium is contracting. This is the only phase where atrium is contracting. So I am marking this phase. So this is my atrium systole phase, atrium systole or atrium contraction phase. So if I ask you last rapid filling phase coincide with, your answer will be last rapid filling phase coincides with the atrium systole or atrium contraction, atrium systole or atrium contraction, right? And the duration of this phase is 0.1 second. So now if I look at the whole diastole, we have discussed 4 phases. Although there is another phases, I am coming to that. So that is isovolemic relaxation, then first rapid filling phase, then diastasis, and then last rapid filling phase. But if I ask you within these 4 phases, filling of ventricle is occurring in which phases, then obviously your answer is filling is not occurring during this isovolemic relaxation phase. No filling, because all the valves are closed. Filling is only occurring during this first rapid filling phase, diastasis, and this last rapid filling phase. Now within this filling phase, three filling phases are there. If I ask you how much percentage of filling occurs during the last rapid filling phase, so please note down, atrium systole or atrium contraction is responsible for 25 to 30% of the total ventricular filling, right? So this means that another 70% of the filling has already been done by this first rapid filling phase and this diastasis phase. So combination of this first rapid filling phase as well as this diastasis phase, they are responsible for 70% of the ventricular filling, and this filling is known as passive filling of ventricle. This is known as the passive filling of ventricle. Now what do you mean by passive filling? If I ask you during this 70% filling, is any chamber, whether it is atrium or ventricle, are they contracting? Answer is no. Both of them are relaxing. Atrium is also relaxing, ventricle is also relaxing, but automatically filling is occurring due to atrium pressure is higher than that of the ventricular pressure. So obviously this 25 to 30% filling, this filling of ventricle is contributed by active contraction of the atrium, and that's why this is known as active filling phase of ventricle. This is known as active filling phase of ventricle. Getting my point? So active means ventricle is not contracting actively. Okay, active is meaning the active contraction of atrium is contributing ventricular filling. This is very important. I told you, okay, that last rapid filling phase is due to atrium contraction, and the filling which is occurring during this last rapid filling phase, this is known as active filling of ventricle, because it is contributed by active contraction of atrium. Right? So all the 4 phases of the diastole is described. Now if you go back to the phases of diastole, then you have seen that there is another phases which is known as proto-diastole phases. Okay, so why we are discussing proto-diastole at the last of the diastole discussion? Because in some of the books, particularly the cardiovascular physiology books, they are saying that proto-diastole is not there in the cardiac phases. They are not describing the proto-diastole, but in Genome the proto-diastole phase has been given, and some of the author are also in line that proto-diastole is part of the systole. That's why we are discussing proto-diastole at the last. Okay, so you have to go back to this starting of the onset of diastole point again. So start of diastole. So I told you what is the condition of the right ventricle at the start of diastole. Start of diastole means that is end of systole. So ventricular chamber is fully contracted and most of the blood has been ejected. Now if I ask you, whenever the ventricle will start its relaxation, okay, what will happen? First the volume, there will be enlargement of the ventricular cavity, or first the muscle will be relaxed. Getting my point? So what I am saying, suppose this right atrium is fully contracted. Now the right atrium wants to relax. So what will happen? First there will be enlargement of this cavity, or first there will be relaxation of this muscle. Obvious thing is that whenever the muscle was contracting, there was huge amount of calcium at the level of muscles. We know the molecular mechanism, right? So you have to remove the calcium from the cytoplasm to the sarcoplasmic reticulum, and that way first of all you have to cause relaxation of this muscle. Then and then only when the relaxed muscle is enlarging the cavity, then there will be closure of the semilunar valves. Getting my point? Because I told you that closure of this semilunar valve will only occur whenever the ventricular chamber pressure is falling, and that will occur when the ventricular chamber is expanding. But before the expansion of this ventricular chamber, there will be first relaxation of the muscle at the molecular level, right? So the systole is over, blood is still going towards the pulmonary artery. Now the muscle is getting relaxed, and then the muscle will start enlargement of the ventricular cavity. So there is a time gap between starting of this muscle relaxation followed by enlargement of this cavity, and this time gap is known as proto-diastole phase of ventricle. So proto-diastole phase means I can understand that this is only the muscle relaxation, okay, only the muscle relaxation. Exactly, the chamber dilatation has not been started yet, only the muscle is getting relaxed, and it is part of the systole. Some book is saying why, because still the blood is going towards the pulmonary artery, right, and the muscle is taking preparation for relaxation. That phase is known as proto-diastole. So I am writing here, the proto-diastole phase has a very short duration, very short duration, right, and this duration is 0.04 second, okay, and this phase is known as the proto-diastole phase, okay. So beginning of the proto-diastole phase means it is starting of muscle relaxation, okay, it is nothing but starts of muscle relaxation, right, followed by closure of this semilunar valves. Getting my point? So if I ask you what is proto-diastole, the starting of muscle relaxation followed by enlargement of the cavity of right ventricle. Whenever enlargement of cavity, there will be immediate closure of the semilunar valve. So the time gap between these two, that muscle relaxation starting followed by closure of the semilunar valve, this phase is known as proto-diastole phase. I told you already that proto-diastole phase means during this phase the blood is still going towards the pulmonary artery, means that's why some of the books are saying that proto-diastole should be considered within the part of systole, because blood is still ejecting towards the pulmonary artery, right. So now according to Genow, proto-diastole is part of the diastole, right. So now we came to know here that the 5 phases of diastole, that is proto-diastole, isovolemic relaxation, first rapid filling phase, diastasis, last rapid filling phase. I hope you remember the duration. This is 0.04, this is 0.06, this is 0.1, this diastasis is the longest duration 0.2, and this is 0.1. So the total duration is 0.5 second. So this is about diastole, right. Now if I look at this cycle, okay, so now I am going at the end of this diastole, here. So at the end of the diastole, the total volume of blood which is present in a single ventricular chamber is known as end diastolic volume, EDV, end diastolic volume. All of you know. So what I am saying, that you just imagine that this is right atrium and this is right ventricle, right. So your tricuspid valve is still open and ventricle is full with blood. The total volume of blood at this condition at the end of diastole is end diastolic volume. But always remember, normally end diastolic volume, whenever I am saying that value of end diastolic volume is 130 ml, this value, this volume 130 ml, this is for a single ventricle. Remember this, 130 ml for a single ventricle. So end diastolic volume is defined for a single ventricle, right. So whenever the ventricle is filled with end diastolic volume, right, there will be a pressure also, that is known as the end diastolic pressure, because of this volume there will be a pressure in the ventricle. End diastolic pressure for right ventricle, this is 1 to 7 millimeter of mercury for right ventricle, right, okay, and for left ventricle, this is 4 to 12 millimeter of mercury, this is for left ventricle, okay. So please try to remember this information. So end diastolic volume is 130 ml, this is equal for right and left ventricle, but end diastolic pressure is not same in the both the ventricle. For right ventricle it is 1 to 7 millimeter of mercury, and for the left ventricle it is little higher, that is 4 to 12 millimeter of mercury, okay, 4 or 5 to 12 millimeter of mercury, right. So that is end diastolic volume and pressure. Now whenever the ventricle is filled with, okay, end diastolic volume, now there will be starting of systole, or now there will be starting of contraction. So look at the beginning of contraction, what are the condition of valves? The tricuspid valve is still open because the filling was happening, and what is the condition of semilunar valve? It has already been closed at the beginning of the diastole. So the semilunar valve is closed, okay, tricuspid valve is still open, and ventricle suddenly started contraction. So what will happen? Immediately the pressure within this ventricular chamber will be increasing. Okay, so whenever the ventricular pressure is increased, the first tendency of the blood is to go back towards the atrium because the valve is still open, least resistance pathway. So whenever the ventricle is starting contraction, the immediate event is that blood is trying to go back towards the atrium, and that will be prevented by immediate closure of this tricuspid valve. So again the same thing. Immediate onset of contraction means immediate closure of the valves. And which valves? Atrioventricular valve or tricuspid valve. So I can write down here that whenever the ventricle is filled with end diastolic volume, there will be onset of systole. So this is the onset of systole. An immediate event at the onset of systole is nothing but closure of atrioventricular valves. Atrioventricular valves. So I can also understand that closure of the atrioventricular valve means this is the point where the first heart sound will be created. All of you know that thing. First heart sound will be created. So immediately at the onset of systole, there is closure of the atrioventricular valve. Now you look at the ventricular chamber. So your tricuspid valve is just closed, right? And your semilunar valve is already closed, and the ventricle is contracting. So how much blood is present in the ventricular cavity? End diastolic volume. So when the ventricle is contracting with all the valves closed, do you think the volume of the blood is going to change? Answer is no. The volume of blood will remain end diastolic volume only. So during this contraction phase, because the volume is remaining same in the ventricular chamber, this phase is known as isovolumic contraction phase. So after the closure of this atrioventricular valve or tricuspid valves, the next phase of cardiac cycle that is going to happen is nothing but isovolumic contraction phase of cardiac cycle with a duration of 0.05 second. With a duration of 0.05 seconds. So this is isovolumic contraction phase. Let me color it. Relaxation. So this is isovolumic contraction phase. Now, what is going to happen at the end of isovolumic contraction phase? Very, very important. So at the end of isovolumic contraction phase, we all know that this semilunar valve is going to open because now the ventricle has to eject blood. But question is, when this semilunar valve will open up? So to open up the semilunar valves, what is the bottom line is that the ventricular pressure should be greater than pulmonary artery pressure. Right? If you think of right ventricle, this is the condition. If you think of left ventricle, then the ventricular pressure should be greater than aortic pressure. Am I clear? Right. Because whenever the semilunar valve was closed, what was the pressure at the level of pulmonary artery? We know the pulmonary artery pressure is 25 upon 10. What is the meaning? Meaning 25 is the systolic pressure, 10 is the diastolic pressure. So when the semilunar valve was already closed, what was the pressure present at the level of this pulmonary artery? 25 or 10? That I am asking. That if the semilunar valve is closed, what will be the pressure at the level of pulmonary artery? Obviously, semilunar valve closed means the pressure will remain at the lowest because blood is not coming to the pulmonary artery. So how much pressure is present at the level of pulmonary artery when semilunar valve is closed? That is 10 millimeter of mercury. Whenever the right ventricular pressure is greater than pulmonary artery pressure, that is nothing but 10 millimeter of mercury, immediately the semilunar valve will open up. Getting my point? So to open these semilunar valves, how much pressure I have to generate at the level of ventricle? That is greater than 10 millimeter of mercury. But if you look at the left ventricle, so all of you know that for left ventricle, aortic diastolic pressure is 80 millimeter of mercury. You all know that aortic pressure is nothing but our normal blood pressure, that is 120 upon 80. So for right ventricle, to open the semilunar valves or the aortic valve, how much pressure the ventricle has to gain? That is more than 80 millimeter of mercury. That's why the left ventricular pressure, whenever it is greater than 80 millimeter of mercury, the semilunar valve will open up immediately. So right ventricle is generating or gathering only less pressure, that is only 10, and left ventricle has to generate 80 millimeter of mercury pressure, and that's why the left ventricular muscle mass is at least 3 times thicker than that of the right ventricular muscle mass, because it has to gain more pressure to eject the blood at the level of arch of aorta, right? So now we have understood that what is the mechanism of opening up this valve, that the pressure in the ventricular chamber should be more than pulmonary artery pressure or aortic pressure, and then only this will leads to opening of semilunar valves. Getting my point? So opening up of semilunar valve will occur at the end of isovolumic contraction. Now if there is opening up of semilunar valve, that is no big deal. Now this is very easy. Why? Because now the blood is going to be ejected at the level of, so if I draw another diagram here, so now my semilunar valve is open, okay, tricuspid valve is closed, okay, now the ventricle will eject blood towards the pulmonary artery, right? So immediately after opening of this semilunar valves, the ejection is very faster, that is known as rapid ejection phase, and after some point of time the ejection becomes slower, that is known as slow ejection or reduced ejection. So if I divide this ejection phase into 2 halves, so that is one is rapid ejection phase and second one is slow ejection phase. If you look at the duration, the slow ejection phase has more duration, that is 0.15 second, and rapid ejection phase has a duration of 0.1 second, right? So combination of these 3, again you can find out that this is 0.3. So this is rapid ejection phase and slow ejection phase. This is part of ejection phase only, so I'm giving a single color here, right? Now during this rapid and slow ejection phase, the total volume of blood that is going out of the ventricular cavity, okay, so you look at here, what was the total volume of blood at the beginning of systole? That was the end diastolic volume. This was the blood with which the ventricle started contraction. Now from this end diastolic volume, some portion of the blood is ejected during rapid ejection phase, some portion of the blood is ejected during the slow ejection phase, and the total volume of blood is known as the stroke volume. So stroke volume, again it is defined for a single ventricle. The normal value of stroke volume is 70 to 90 ml, right? The 2/3 of 70 to 90 ml, the 2/3 of stroke volume is ejected during the rapid ejection phase, and 1/3 of the stroke volume is ejected during the slow ejection phase. So if you look at the duration of the slow ejection phase is more than that of the rapid ejection phase, but most of the blood, that is 2/3 of the blood, is ejected during rapid ejection phase and 1/3 of the blood is ejected during the slow ejection phase, and the combination of these two, rapid and slow ejection blood volume, is known as the stroke volume of the ventricle, which is generally 70 to 90 ml. So end diastolic volume was 130 ml, okay, end diastolic volume was 130 ml. From that 130 ml, ventricle has ejected only 70 to 90 ml during ejection. So I can easily understand that 130 minus this 90, okay, that means at least 40 ml blood is still remaining within the ventricular chamber even at the end of systole. So I can understand here, okay, point out which point is the end of systole. So this is the point which is indicating end of systole or end of ejection. The volume which is still remaining at the ventricular chamber, this is known as end systolic volume. Getting my point? So end systolic volume is that volume of blood which is still remaining in the ventricular chamber even after the ejection is completed. And what is the approximate value? The end systolic volume is nothing but EDV minus stroke volume is equal to your end systolic volume, and that is approximately 40 ml. Now with this end systolic volume, okay, what is next going to happen? Next we know, next this protodiastole phase will start. Protodiastole is nothing but muscle relaxation. After protodiastole, again this isovolumic relaxation is going to start, and I already told you that isovolemic relaxation means the ventricular blood volume is not going to change during this phase. So if I ask you, what is the volume of blood present in the ventricular cavity during isovolemic relaxation phase, your answer will be this is nothing but end systolic volume, sir. So with end systolic volume, we had started our discussion from here that at the end of systole, what is the condition of this right ventricle? The right ventricle is fully contracted. Okay, the tricuspid valve is closed. The little amount of blood is present in the ventricular chamber. Now you came to know what is the name of this blood. This is nothing but end systolic volume, which is approximately 40 ml. Right? With this 40 ml blood, whenever the ventricle will start its relaxation, immediately the pressure within the chamber will drop down, and this part we have already discussed. This will leads to immediate closure of this semilunar valves, and that will leads to starting of isovolemic relaxation phase. Getting my point? So now if you look at this diagram, now this diagram is looking very beautiful with multiple colors, and all the phases of cardiac cycle has been discussed. So after looking at this diagram, if I ask you why we are discussing ventricle only during cardiac cycle, what about atrium? Look at atrium will contract only once, and that is corresponding with which phase of cardiac cycle in the ventricle? That is the last rapid filling phase. Getting my point? So atrium will contract only during this phase. Now if I ask you what is the condition of atrium in all other phases of cardiac cycle, if I ask you what is the condition of atrium during this isovolemic contraction, rapid ejection, isovolemic relaxation, first rapid filling phase, diastasis, what is the condition of atrium? Atrium is doing nothing. Atrium will remain in a diastolic condition during all these phases. Atrium will only contract during last rapid filling phase. So basically you know that this will go on like this. Atrium will contract and then it will relax slowly. By the time ventricle will contract, again relax. Again atrium will give a push, then atrium will go for relaxation. By the time ventricle will contract, relax. Again it will give a push and start relaxation. Then the ventricle will contract and relax. This way the cardiac cycle is going on, and you have to look at the ventricular event rather than that of the atrium event, because atrium event is only contraction for 0.1 second and then relaxation. Getting my point? So this way you have to read about cardiac cycle. So now if you look at the systolic phases, okay, isovolemic contraction, what is the duration? 0.05 second. Rapid ejection, I told you duration is shorter, but most of the blood is ejected during these phases, and the slow ejection phase, the duration is prolonged, so the total duration is 0.3 second. So this is all about different phases of cardiac cycle described with the help of this diagram. I hope all of you get it. Okay.